Welcome to The Explainer. Today, we're going to tackle a really tough one, chronic pain. We're going to unlock this sort of secret network in the body to find answers that, are often hiding right in plain sight. All right, let's just jump right in with a question that might sound kind of weird at first, but trust me, it gets right to the heart of what we're talking about. What if your chronic jaw pain was actually being caused by an old injury in your foot? And no, that's not just a hypothetical, it's a real clinical possibility. And it shows just how much we sometimes misunderstand where chronic pain actually comes from. And here's why. As Dr. John Beck puts it, when you're dealing with a chronic condition, your body is so smart, it creates all these workarounds, these compensations. And what that means is, the spot that actually hurts, a lot of the time, that's just the end of the story, a distraction. It's the symptom, not the real problem, which could be happening somewhere else in your body entirely. So to crack this case, we've got to look under the hood. We need to understand this huge, kind of secret communication network that's inside all of us. Think of it like a master controller, working silently in the background, running the whole show. And that system, it's called the autonomic nervous system, or the ANS for short. The best way to think about it is like your body's own brilliant autopilot. It's on 24/7, making constant little tweaks to keep everything running smoothly, keeping you in what's called homeostasis, that perfect internal balance. And get this, the scale of this thing is just mind-blowing. The ANS makes up a whopping 70% of your entire peripheral nervous system. It is literally the silent majority, doing all the heavy lifting without you ever having to give it a second thought. So what's on its to-do list? Oh, just about everything that keeps you alive. We're talking heart rate, breathing, digestion, blood pressure, you name it. The ANS is that tireless manager, making sure all systems are go, all day, every day. Okay, so if this autopilot is so important, so huge, what happens when it starts getting bad intel? What happens when the signals get scrambled? Well, for a long, long time, the thinking was that our nervous system was basically hardwired once we became adults, set in stone. But it turns out that's completely wrong. The reality is our nervous system is plastic. It can change, it can reorganize itself its entire life. And that can be a really good thing, or it can be a really bad thing. And a lot of the time, the problem kicks off with something called neuritis. It's basically an inflamed sensory nerve. Maybe it's from some old injury you don't even remember. And here's the tricky part. It doesn't show up on an MRI or an X-ray. It's totally invisible to those tools. But what it does is act like static on a phone line, just feeding a constant stream of distorted, faulty information right to your central nervous system. Dr. Beck had a brilliant way of putting it. The brain, it doesn't have a spam filter for this bad data. It just accepts it as truth. And when it starts making decisions based on faulty information, well, you end up with what he called a crooked house. Your body's posture and the way it works just get thrown completely out of whack. So what you get is this state of constant, low-level alarm. It's called dystrophia or central sensitization, and it basically puts your whole autonomic nervous system on red alert, permanently. This sets off a chain reaction, a whole cascade of symptoms that seem totally unrelated. Things like cold hands, a racing heart, sweating, all because the system is operating on bad info. Okay, now this is where things get really, really interesting. This is the craziest part of the puzzle. Because the body, when it's in this state of distress, it actually gives us the exact clues we need to find the real source of the problem. But it does it in a way you would never expect. What happens is, under all this chronic stress from the faulty signals, our highly evolved adult nervous system, it regresses. It actually starts acting like a baby's nervous system again. It brings back these primitive infantile reflexes that we're all supposed to grow out of. And this is how the detective work starts. There's a test called the light/dark test that shows this regression in action. You see, a baby's nervous system is super sensitive to darkness. Well, it turns out that in an adult whose system is in this distressed state, just looking at something dark can cause a noticeable, measurable drop in their muscle strength. It's a dead giveaway that the system has gone haywire. Here's another great example, the parachute reflex. You know how a baby will instinctively throw its arms out if it feels like it's falling? That's the one. Well, in an adult who has, say, forward head posture from something like jaw inflammation, the brain can misinterpret that constant forward lean as always falling. So what does it do? It reactivates that old, primitive parachute alarm. So this whole regression thing, it's not just some weird side effect. It's actually a roadmap. These primitive reflexes that pop back up, they're like big, flashing neon signs pointing the way right back to the original source of that nerve inflammation. And the toolkit that lets us read that roadmap is called Motor Nerve Reflex Testing, MNRT. It's basically a system for decoding all these reflex signals to figure out what the brain sees as the number one priority injury, the root cause that it's trying to protect more than anything else. Now, it's really important to get this. MNRT isn't about testing how strong you are, like how much you can bench press. That's your conscious voluntary system. Instead, it's testing your involuntary reflexive postural system. This is the deep, automatic stuff that holds you upright without you thinking about it. And that's the system that gets messed up by these bad nerve signals. So the process itself is really logical. It's like a step-by-step investigation. First, a simple wall test checks to see if there's a big imbalance problem to begin with. If there is, they move to the light/dark test to see if the whole system is in that distressed dystrophy state. And if that's a yes, then they use a whole bunch of other specific reflex tests to follow the trail of breadcrumbs right back to the source. And by following that trail, by following those clues, that's how you can finally uncover the true source of this whole chronic pain puzzle. And what this kind of investigation shows again and again is this incredible twist in the story. The part of your body that's screaming in pain, more often than not, it's just the fall guy. It's a compensation. The real problem, the original injury, is silent. Why? Because your body is so good at its job, it's successfully protecting it and just shifting the stress somewhere else. It really all boils down to that old computer saying, garbage in, garbage out. By using a system like MNRT to find the original source of that garbage in signal, a practitioner can treat that silent inflamed nerve. And once you clean up the input, the brain can finally reset. The garbage out, all that pain and dysfunction, can finally start to clear up. So we'll leave you with this question to think about. Could the key to your chronic pain, or someone you know, be some old, forgotten, silent injury that your body is still, to this day, desperately trying to protect you from? It's a totally different way of looking at it, right? It reframes chronic pain not as a life sentence you just have to manage, but as a solvable mystery, a message from your body that's just waiting for someone to finally listen.